Viewing through the infralaterally placed arthroscope, you will see the cannula and trocar enter the joint through the posterior wall. Initially, on endaural puncture, the posterior bilaminar zone and oblique protuberance can be readily visualized. Note how the medial trough visualization and access is facilitated. With a 30-degree scope introduced into the endaural portal, a rubber cap is inserted in the infralateral cannula to act as a seal around instruments. The infralateral cannula is closed with the thumb, and outflow through the infralateral cannula is confirmed. It is important to confirm the through-and-through lavage every time you change portals to prevent extravasation of fluid. Here we can see a left temporomandibular joint with a 30-degree arthroscope inserted into the endaural portal. We can visualize the lateral trough with its adhesive capsulitis present, with a vascularized synovial proliferation attaching with adhesions to the disc and articular eminence. This is described as a lateral capsular prolapse or impingement syndrome. An 18-gauge needle is used to dissect and free the adhesions from the articular disc as visualized in this videotape. Many times these are tenacious bands of adhesions. The proliferative synovitis can be readily visualized by the vascular markings and relative maturation of the adhesions. In this right endaural view from a different patient, one can see the right lateral trough with a proliferative villonodular synovitis. Note the vascular channels running up through each of the synovial villi. The infralateral cannula can now be used to insert instruments into the joint. Here we can see a small cartilaginous fragment being pressed between the articular surface of the eminence and disc. A grasper forceps is utilized to retrieve the small fragment from the articular surfaces. From an endaural view, with the 30-degree arthroscope, a blunt trocar can be seen inserted into a right temporomandibular joint from an infralateral approach. The blunt obturator is utilized as a dissector to free up the lateral synovial trough. This is performing a lateral capsular stretch maneuver in order to free up the restriction of the lateral capsular impingement. The blunt probe is rubbing along the lateral surface of the articular tubercle at this point and is seen freeing up the lateral capsule from its structure. In this case, a small cup forceps is introduced to remove synovial adhesions and granulation tissue. Here we can see the reactive granulomatous tissue in a previously operated joint with reactive and proliferative synovitis. The cupped basket forceps can be seen removing tissues from this superior joint compartment for debridement and histopathologic examination. In this case, a blunt hooked probe is used to test the tenacity of broad adhesive bands in this severely restricted superior joint compartment. One can see the relative amount of vascular markings apparent in these broad bands. Here, The adhesions are being wiped away from the articular eminence with a pulling and stroking motion of the probe. Due to their adherence, it was felt that a pull knife would be better utilized. Here, you can see this being used for the lysing of the adhesions.